Adversity is our greatest opportunity for spiritual growth. I write that in the cover of books all the time for my patients when they're diagnosed with cancer. And for my breast cancer patients, that adversity that they're experiencing comes in the form of cancer. Currently, everyone on our planet is experiencing the adversity of COVID-19, whether it's someone that has it, someone that is working in the healthcare profession, caring for those who have it, or possibly just being sequestered at your home, not going to your job on a daily basis, not going through your activities of daily living, feeling like everything else has been flipped upside down. So what I want to try to do is bring some things back into focus, maybe try to look at things a little bit differently. First and foremost, I want to give some really practical advice, which I think that everybody watching this should do. You hear every day about washing your hands and sanitizing your hands, not touching your face, wearing gloves in public when you go to the grocery store and throwing them away. I tell my patients to leave their shoes at the door, particularly if they're going through chemotherapy or some kind of intervention for their cancer. Another thing is a mask. Cloth mask can simply prevent you from touching your face. And if you happen to be an asymptomatic carrier, if you're someone who happens to have the virus and you're shedding the virus, so you don't know it, that mask can keep you from becoming a vector for other people. And so that's another really, really important thing to focus on. The other thing is do something nice for someone who is a healthcare worker, EMS, police, somebody who's continuing to work every day to keep your life somehow normal. Do something good for them and pay it forward, because it's really going to help. One final thing is, if you are short of breath and you have COVID, get to an emergency room or a hospital. We know that not being able to hold your breath for 10 seconds is a sign that your respiratory system is going to need help. And at that point, the only help that you're going to get is going to be within the health system. So today's a different day because our world's come to a halt in so many ways. So many businesses are shut down. People aren't going to work every day. It's this virus is happening with us. It's not happening to us. It's actually becoming part of our everyday and part of everybody's conversations. Nothing like this has ever happened in our lifetime. Nothing this global has happened. And when you think about it, right now, the only one that's benefiting from COVID is the Earth, because all of the Earth's resources and things that were being depleted with the air pollution and the water pollution, and those resources are actually getting a chance to heal again, because we've shut down and we've come inside and we've stopped going to doing some of the same things that we've been doing in industry over the last millennium. And right now we have a lot of shifts going on, and there's a choice. And I tell patients this all the time. When my patients are going to sleep in the operating room, I say that you can't be in two emotions at once. So you can either be in love or you can be in fear. So what I do is I get them to visualize the place that they love most on the earth. And as we're going into the operating room and as they're going off to sleep, I get them to talk about it, and I try to paint a picture of a place that takes them into a place of love, because you cannot be in love and fear at the same time. And right now you have a choice. So instead of looking at these huge shifts as all the negatives, the inconvenience, I've lost my job, the lives that are being lost from COVID, kind of come back to that space and find your heart center. Find whatever makes your heart sing. Find that place that brings you to the place of joy. For me, it happens to be on top of Cathedral Rock here in Sedona, Arizona. It's the place that I came every single year for 17 years with my husband and kids for spring break. And that is my heart center. That's the place that brings me joy. So if I'm in a day and I'm listening to the news, which I try not to, and I'm getting into negativity, I try to take a deep breath, close my eyes, and get myself back centered into that place of love. The other thing that we have to recognize is that we've all been asleep. The human race has been asleep. We're kind of gone along unconsciously, going to stores and buying things that we didn't need and buying food that we were never going to eat. And now we're being forced to go inward to try to find what really matters for each of us. I had an opportunity this past Friday, to do a 1-hour event with one of the companies I work with. So I had 68 of their sales force on a Zoom call, which normally I'd be in a room with 68 people, but this is great because they were all in their own homes or their backyards. And I was able to try to help them recognize that this is a massive global awakening. This isn't just happening to them in their small world. It's happening to everybody outside. And I know that in the epicenters in New Orleans and Washington and New York, the tidal waves already hit them. What we're seeing right now in most of the rest of the country is we're watching that water recede before the tsunami hits us. And having that time to prepare, we know that we have to come collectively together to be able to make things better, not just for our health system and for the people that we care for, but actually, as a planet, completely. And we're going to get healthier and be healthier if we choose to find positive things that are coming out of this process. Yesterday, one of my dear friends became a grandmom, and her grandson was born on April 4th, 2020, which in numerology is a 444, which is a very special number, which I will get into in a future YouTube cast when I talk about Earth Day. And I tried to reframe this for his parents, saying that, if this was a normal time in our lives, you'd be back at work anywhere from, in 6 weeks. But at this point, we're looking at least 12 weeks, maybe, we're going to have 12 months of social isolation. So how we work is going to be very different. And look at the positives about being able to be home longer with your children that are just born. Parents being able to be home with their kids now. They're out of school. And yes, it's stressful having them there, but, participating in their education, not just leaving education up to a school system. It's also shown us that our Western medical model, although it can be amazing at acute care, COVID has really taxed the system because we have built a healthcare system now to not rely on so many inpatient beds because so many things have become outpatient. We don't have the need this often for this many ventilators and this much care. And it's unfortunate because what I've been finding, across the globe is a lot of patients that end up on ventilators, they're not going to make it off ventilators. And ones that do, we're trying to learn how we stratify that. And unfortunately, in Italy, they had to start rationing who gets ventilators based on the health of the population. So of any time in our entire society, this is going to make us, reevaluate how we look at health and wellness, where we've been moving toward a focus toward health and wellness and promoting wellness, but we still have a healthcare system that's modeled on treating disease. And that's going to be a major shift for all of us. So in reality, we have a new normal. And the new normal means that those of us who cannot adapt and adjust, those of us who are brittle and break at the thought of changing what our life is like, probably aren't going to be here, because that's what evolution is. You have to be able to adapt and adjust. My life, my practice is not going to look the same. I know that. Healthcare is not going to look the same. And what we've done, we've got Zoom dinners. I've been Skype cooking with my kids for years. Now we use Zoom because we can get more people on the screen at once. We had a Zoom birthday party for my girlfriend Jody last week, where we had about 15 friends on the call at the same time. I had the Zoom happy hour for this company on Friday night. And I've reconnected with my girlfriends. We were supposed to be together in Rochester for 5 days coming up in April. We're not going to be there now. But now every Saturday night, we're together for 15 or 20 minutes on Zoom, and we're staying connected. So we're learning that our connectedness isn't related to just being physically in the same room. And I've said all along, and I've talked about this in my second book, which I haven't published yet, called Shifting Gears. We take our family of 4 and we get connected over Zoom, over dinner. When I go out to dinner and see a family of 4 looking at their cell phones, and they're staring at their cell phones and they're not looking at their families, they're missing the opportunity to be present with the people that you love. So I'm going to give you the to-do list right now, which is pay it forward. Find somebody, and you have to have people in your lives who are less fortunate than you during this COVID crisis, and do something nice. Go grocery shopping for an elderly neighbor. Give somebody something. You may have extra rolls of toilet paper. My chief anesthesiologist knew that I was working every day in the OR for the past 3 weeks, so he brought in a couple rolls of toilet paper, which I thought was the sweetest gift ever. Create a gratitude journal. Write down the things you're grateful for, because gratitude brings peace in your heart. Get out in nature. Plant a garden. Go on YouTube and find the positive videos. Get away from watching the news that is all doom and gloom 24/7. It is not healthy for you. I stopped watching the news a long time ago when I moved out here to Sedona, and I choose to find the things that are positive, where I can make my choice about what I want to watch. Write the book that's been in your head. I am going to finish my second book, and now I know why I haven't finished it, because I didn't realize the amount of shift that the shifting gears I had talked about had created. Go back to painting, learn how to cook, figure out what your creativity is, find your joy and your gifts and use it. So the future is not going to be about the material things. It's not going to be about hoarding, and it's not going to be about being busy just to be busy. It's really time to truly shift gears back to a more simple, more authentic way of being. And healthcare is going to be the same way. We are going to have an unfortunate number of healthcare workers who burn out from this COVID crisis. And we're going to have to help the healers heal, because what my colleagues are experiencing on the front line and what I may be experiencing 6 weeks from now takes a toll on us emotionally, spiritually, and mentally. And we need to create a healthier planet so our kids have a great place to live. So as I end this, clean your cell phones. Number one, first and foremost. Everybody touches it. It's dirty. I watch people cleaning their hands and washing their hands and putting their masks on. We clean our cell phones constantly when we walk into the hospital. We have little cell phone cleaning stations. So get some alcohol and clean your cell phones. Wear your mask out in public in case you have it to keep from spreading it. Sanitize your hands. Wear gloves in public places. Drop your shoes at the door, and do something nice for a healthcare worker and someone that's on the front line, because it could be your family member. Like all of my sisters, want to know how we do it every day. My niece and I are both on the front line. She's a physician's assistant. And it's the little things that people do for us to make our lives better that keep us going back to the front line. So stay home and stay healthy. Thanks.